The senator from Arizona.
Ask unanimous consent to send to the desk at this time a motion to commit with instructions.
Without objection. The clerk will report the motion.
The senator from Arizona, Mr. McCain, moves to commit H.R. 3590 to the Committee on Finance with instructions to report the same back to the Senate with changes that do not include the following. 1.
Madam President, I ask unanimous consent that further reading of the motion be dispensed with.
Without objection.
Madam President, simply put, this motion to commit would be a requirement that we eliminate the $500 billion in Medicare cuts that is envisioned by this bill. $500 billion in cuts that are unspecified as to how, and $500 billion in cuts that would directly impact the health care of citizens in this country. Medicare Advantage cuts totaling $118 billion. An independent Medicare advisory board that would cost $23 billion. Expansion, Medicare hospital penalties totaling $7.1 billion. Home health care cuts totaling $42.1 billion. Hospice, of all the things, hospice, some $8 billion. And the list goes on and on. All of these are cuts in the obligations that we have assumed and are the rightful benefits that people have earned, and our citizens, particularly our senior citizens across this nation. This eliminates $500 billion in cuts to Medicare that are cuts which are unspecified. I will eagerly look forward to hearing from the authors of this legislation as to how they can possibly achieve $500 billion in cuts without impacting existing Medicare programs negatively and eventually lead to rationing of health care in this country. That's what this motion is all about. This motion is to eliminate those unwarranted cuts. Now, all of us know that there are enormous savings in fraud, abuse, and waste that can be identified. No expert that I know of believes that that would come up to $500 billion. Hospitals are cut by $105 billion. Nursing homes are cut by $14.6 billion, and hospices are cut by $7.6 billion. These are not attainable cuts without eventually rationing health care in America and rationing health care for our senior citizens who have earned these benefits, and we have guaranteed them these benefits. And for the life of me, how the AARP can support this 2,000-page legislation is beyond my imagination. And seniors all over America, seniors all over the state of Arizona, including the 330,000 senior citizens in my state that are under the Medicare Advantage program, which is going to be drastically cut by some $120 billion, are outraged. And the more they find out about it, the more angry they become. So here we are, as my colleague from the great state of Iowa and a leader on health care just articulated, in a totally partisan measure before the United States Senate, in which no member on this side of the aisle has been consulted in any way. I would point out to my colleagues, historically, there has never been a major reform implemented by the Congress of the United States unless it's bipartisan in nature, and I don't believe that the American people want this 2,000 and some page monstrosity, which is full of all kinds of provisions that they are either unaware of, or even in the study of this legislation, many of us have also become unaware of. But fundamentally, the Bernie Madoff accounting, the Enron accounting that's been going on with this bill is dependent on envisioning $500 billion in cuts which are not attainable. If they are attainable, then it would mean a direct curtailment and reduction of the benefits that we have promised the senior citizens of this country. It's not acceptable. So what this motion to commit does, it sends it back to the Finance Committee, come back with another bill. Only this time, don't put the cost of it on the backs of senior citizens of this country. Don't do it. You know, it was back last summer, 3 months before he was elected president, on a campaign stop not far from Washington, D.C., now President Obama vowed not only to reform health care, but to do it in a new way. He said, I'm going to have all the negotiations around a big table, televised on C-SPAN, so that people can see who's making arguments on behalf of their constituents and who are making arguments on behalf of the drug companies or the insurance companies. Americans wanted to believe this would be true. Republicans offered to work with the majority on our ideas, but that was rejected. And so what has happened? Business as usual. Let me read from a report this past weekend about business as usual. The Associated Press has moved a story saying that healthcare lobbyists and other interests have made 575 visits to the White House between January and August. The report is based on records released by the White House on Wednesday. The timing of the release smells of a classic Washington tactic, dumping bad news on the getaway date before a long weekend. Clearly, the White House, which prides itself as being the most transparent administration in the history of the world, hopes this nugget gets lost over the four-day Thanksgiving weekend. Top aides to President Barack Obama have met early and often with lobbyists, Democratic political strategists, and other interests with a stake in the administration's national health care overhaul. White House visitors' records obtained Wednesday by the Associated Press. Now, all of my fellow citizens who are watching on C-SPAN, I urge you, call the White House. Say you'd like to have an appointment. You'd like to have an appointment to meet with the president or members of the administration in the White House. 575 special interests were able to get in. Why can't you? Give them a call. Tell them you'd like to meet with the members of the administration. That's what 575 lobbyists have been able to do. Give them a call. The records show a broad cross-section of the people most heavily involved in the health care debate, except for average citizens, weighted heavily with those who want to overhaul the system. Talks about who's among them. The list also includes George Halvorson, Chairman and CEO of Kaiser Health Plans, Scott Sirota, President and CEO of the Blue Cross and Blue Shield, Kenneth Keyes, a Washington lobbyist who represents Blue Cross Blue Shield, among other clients, Billy Tozan, head of pharma, the drug industry lobby, Richard Umdenstock, chief of the American Hospital Associations, several lobbyists for powerful health care interests, including insurers, drug companies, and large employers, also visited the White House complex, the records show. So, again, citizens, why don't you call the White House and ask for an appointment? The lobbyists and the special interests, big donors get it. They're not ambassadors. They're lobbying the White House on this issue. My friends, health care reform should have been about both sides sitting down together and fixing what's broken, reducing health care costs while preserving the highest quality health care in the world. Somewhere in the course of this debate and the process of this legislation, we've lost sight of the fundamental problem with health care in America, and that's the cost of health care in America, not the quality. And this legislation will destroy the quality and the availability if the cuts envisioned in this legislation, in this Enron accounting measure, where the first 4 years after this suppose that this legislation was signed on the 1st of January by the President of the United States. Immediately benefits begin being cut, immediately taxes go up, and guess what? None of the benefits will be given to any American citizen for 4 years. So that's how you get deficit neutrality. That's how you get deficit neutrality. If you started giving the benefits at the same time you raise the taxes, my friends, you've got about $1.3 trillion in deficit in a $2.5 trillion bill. $2.5 trillion piece of legislation. My friends, here we are with the highest deficits in history, with our deficits and debts as far as we can see, with a stimulus package that has been done so well. We now have 10.2% unemployment, and many predict that it's even going higher. But Wall Street's doing fine, and these lobbyists are doing fine. This one, Mr. Tozan, the pharma lobbyist, he's doing fine. I understand his salary is around a couple of $1 million a year, not to mention all the other perks. But the average citizen, the 330,000 citizens of my state who have the Medicare Advantage program, are going to see it cut and cut and cut over and over again. About $120 billion worth. So what happened? The White House engaged in the tradition of handing out favors to special interests, including pharma, AARP, and AMA. And shame on AARP, and shame on the AMA. We know there are many common sense reforms that Americans want. We know that they're needed, that can work. By the way, in this monstrosity, find me any significant, real medical malpractice reform. Medical malpractice, the threat of it causes physicians to practice defensive medicine. The CBO estimates that it would be roughly a savings of $54 billion over 10 years. That does not take into consideration the cost of defensive medicine that doctors have to practice because of fear of being sued. I'd ask the distinguished chairman of the committee, where is any meaningful medical malpractice reform in this 2,000-page bill? Where is it? You know, I had a town hall meeting the other day in Arizona, as I do quite frequently, and there was a lot of doctors that came. They had requested it, doctors, nurses, and caregivers. And I asked them, what do you do about medical malpractice reform? And every one of them said, we practice defensive medicine. We prescribe additional tests and procedures. We have to do it because we'll find ourselves in court by the trial lawyers. Do not underestimate, my friends, the many special interests and their influence in this legislation, but do not underestimate the stunning success of the American Trial Lawyers Association, who have made sure that there is no provision in this bill that has to do with medical malpractice reform. And by the way, if there is an example, it's called the state of Texas. State of Texas enacted meaningful and yet not draconian medical malpractice reform. Premiums have gone down, cases have gone down, doctors are flooding back into the state of Texas, and it has worked. So you're going to hear from the other side that there may be demonstration projects, there may be this or maybe that. The demonstration project is the state of Texas. That's all we have to do. It's already been proven. So instead of a reform which could save tens, if not a couple of $100 billion, what are we going to do? We're going to cut hospitals by $105 billion, nursing homes by $14.6 billion, hospices by $7.6 billion, and the list goes on, up to $500 billion. And my motion will send it back to the Finance Committee and tell them to remove these unnecessary, unneeded, unwanted, harmful cuts in the Medicare system, which will not allow us to fulfill our obligation to the senior citizens of this country. Buried in this partisan legislation, as I mentioned, 10 years of tax increases and Medicare cuts that total over $1 trillion. Using CBO numbers, this stack of partisan legislation costs $2.5 trillion over its 10-year implementation. So let me put this in different terms for you. Suppose you want to buy a house. So you go and you buy the house, but the terms of the contract of purchasing the house, either you make the payments on the house for the first 4 years, and then after 4 years, you can move in. That's why this is Bernie Madoff accounting. It's a sham. It's a sham. It's a sham to make people pay taxes and have their benefits cut for 4 years, and then only after 4 years do the benefits kick in. That's the way that with this kind of accounting, they get to deficit neutral. It's crazy. It's crazy. So the increased taxes and Medicare cuts begin impacting Americans and our economy in 32 days if this were passed. Let me repeat this. Starting in January 2010, just 1 month from now, the majority begins tax increases and Medicare tax cuts. Starting in January, but incredibly delays implementation of this bill for 4 years. That's 1,460 days and 208 weeks of new taxes and Medicare cuts before implementation. That is playing games with the American people. If they weren't playing games by delaying the implementation of the bill 4 years after the tax increases and Medicare cuts, we wouldn't even be discussing this pile of legislation because it would be scored as adding over $1 trillion to our deficit. If the other side wanted to be honest and reject Madoff Enron accounting, they'd be talking about the first 10 years of real costs and the first 10 years of their tax increases and Medicare cuts. You know, the other day, the respected dean of the Washington Press Corps, David Broder, pointed this out just last week in his column in the Washington Post entitled "A Budget Buster in the Making." By the way, the majority leader then felt compelled to come down and trash one of the most respected columnists in America, who I don't need to take the time to defend. He can defend himself, and so will many others who have great respect for David Broder. David Broder's column said, "It's simply not true that America is ambivalent about everything when it comes to the Obama health plan." The day after the Congressional Budget Office gave its qualified blessing to the version of health reform produced by Senate Majority Leader Harry Reid, Quinnipiac University poll of national cross-section of voters reported its latest results. By a 16-point margin, the majority in this poll said they opposed the legislation moving through Congress. David Broder went on to say, "I've been writing for months that the acid test for this effort lies less in the publicized fight over the public option or the issue of abortion coverage than in the plausibility of its claim to be fiscally responsible." This is obviously turning out to be the case. While the CBO said that both the House-passed bill and the one Reid has drafted meet Obama's test by being, quote, budget neutral, every expert I have talked to says that the public has it right. These bills, as they stand, are budget busters. Here, for example, is what Robert Bixby, the executive director of the Concord Coalition, a bipartisan group of budget watchdogs, told me, quote, "The Senate bill is better than the House version, but there's not much reform in this bill. As of now, it's basically a big entitlement expansion plus tax increases." These are nonpartisan sources, but Republican budget experts, such as former CBO Director Douglas Holtz-Eakin, amplify the point with specific examples and biting language. Holtz-Eakin cites a long list of Democratic-sponsored budget gimmicks that made it possible for the CBO to estimate that Reid's bill would reduce federal deficits by $130 billion by 2019. Perhaps the biggest of these maneuvers was Reid's decision to postpone the start of subsidies to help the uninsured by policies from mid-2013 to January 2014, long after taxes and fees levied by the bill would have begun. Even with that change, there's plenty in